Here at Sharp-Grossmont Hospital in 2001, we started a lift team, and we decided that we needed to make sure that our employees were safe. So the lift team was able to come in pairs, in teams. We worked 20 hours a day, and all we did was round the hospital, concentrating on the patients that needed the most help with their mobility. The lift team was there with equipment and manpower and knowledge on how to safely move a patient from one area to the next.
I would say safe patient mobilization is extremely important because unfortunately nurses get hurt a lot on the job and support staff get hurt a lot. We're moving these patients all day, every day for 20 to 30 years, and that can really take a toll on your body. So it's nice to know that we've implemented a program that prioritizes the safety of our employees as well as the patients. That way they can continue to do their job. I mean, honestly, one of the things that I really enjoy is that I can use the equipment to move them safely, and that's a really good feeling.
Before I started working here at Sharp-Grossmont Hospital, I worked in construction, and all the heavy lifting of lumber and bricks and stuff had some strain and stress on my back. So when I first started working here at Grossmont, it was a little harsh, a little pain. So once we incorporated these machines, it helped a lot more. Because I'm not using my back as much. Actually, we rarely use our back. We don't pick up anything. The machine does all the lifting for us.
Safe patient mobilization is about working smarter, not harder. Using your brain, not your brawn. I think what it says about Sharp-Grossmont Hospital is that we care. We care about our employees and we care about our patients, and we absolutely care about the whole experience that a patient has while they're here. It's not just about the patient, it's about the families and making them feel comfortable and how we're caring for their family members.